Hello everyone, so we can start the session now. Okay, yeah. So this is the session of INI-CET anatomy quiz. So this is the part first of the anatomy quiz which I am going to start. Okay, so yes, let me just check is the audio okay, and so that we can start the session or not. Then we can proceed with the session. Okay, so let's proceed with the session now. Before starting the session, I would like to give you a general brief about the platform and about myself, and then we can proceed with the anatomy quiz. Okay, so yes, everything is okay. So yes, unlock code. I just want to tell you about the unlock code if you want to see the free sessions on the Unacademy platform. Like today also, I am going to start with a free session that is exactly 6 p.m. So 6 p.m. is the timing when I am going to start with the free session. So actually Monday, Tuesday, Wednesday and Thursday every day 6 p.m. is the free session on the platform of Unacademy. So those who are interested for this MCQ marathon which I am going to start of anatomy MCQ marathon, they can join me on the free sessions of the Unacademy platform. So for that they have to use the unlock code ANAT10. So they can use the code ANAT10 as an unlock code and they can join my session. Okay, so this is my code ANAT10 which can be used by you for being the part of the free sessions on the Unacademy platform and also for taking the subscription. Now what are the features of special class? So when I am talking about special class features, the special class features are that you can attend the session live, interact with the top educators of Unacademy platform, you can participate in the polls and you can raise your hand, ask your doubts, write itself being corrected in the session itself, get notified. So if you start seeing the session, you will follow the educator on the Unacademy app and thereafter you will get the notification regarding the session, and that is how you are not going to miss any of the session. My dear students, lecture notes and PDF notes can be downloaded once the session is finished. Attend the session live and read from the top educators of Unacademy platform. These are the positive points of the special class features and you can avail this opportunity because there are these opportunities available on the Unacademy platform. So I also want to focus on the plus platform positive points. So actually all the 19 subjects can be approached in a very positive way. It can be completed in a systematic way so that you can target your examination. Learn from India top educators, compete in live tests and quizzes and study at the device of your choice. You can assess more than 25,000 MCQs, high yield MCQs of all 19 subjects, and coming soon is the printed notes provided to you if you are going to take the plus subscription of more than 1 year. So these are the benefits of plus subscription. Let me compare it with the Iconic subscription. So if I compare the Iconic subscription, you get the benefit not only of the Unacademy but also of the Prep Ladder. That means both Unacademy and Prep Ladder is merged together and you can get the benefit of Iconic subscription. Clinical integrated essential sessions, video recorded lectures from the dream team of Prep Ladder, QBank 3 can be assessed, rapid revision snapshots and the printed notes of the Prep Ladder. All these is provided to you. So what I suggest, go for Iconic subscription where you can get the benefit of both the plus subscription and that of the Prep Ladder. So my dear aspirants, I would also like to show you the NEET PG and Iconic subscription details and the comparison which is shown here. So you can see the comparison of the 1 year, 2 years, 36 month and 4 years is compared. Use this code ANAT10 and get 10% discount. So if you are planning to take the subscription, you can use this code and get 10% discount. I also want to tell you about the effective QBank which is there present on the Unacademy platform, where you get an access to more than 25,000 high yield clinical MCQs of all 19 subjects. These MCQs are made by the educators who have got an experience of more than 8 to 10 years and includes a detailed description for each and every MCQ. So just target it and just not let it missed out, and use the code ANAT10 to get 10% discount. My dear aspirants, I also want to tell you and inform you about the sessions which is coming up, the plus courses which is coming up on the platform of Unacademy. Target NEET PG 2022 batch is coming up. Clinical case discussion batch, 27th October is the date. So please don't miss out. Be the part of this session. Take the subscription. Use my code ANAT10 and get 10% discount. I would also like to tell you about the exam day free monthly grand test of FMG. So this free monthly grand test of FMG is on 31st October. So 31st October is the date, that is on Sunday. It's a morning session, free MCQ session, that is 10 to 1 p.m. So 300 MCQs are there and it is absolutely free on the platform of Unacademy. So avail this opportunity and get enrolled in this session by using the code NAT10. Now, before starting the sessions and MCQ session, I want to congratulate the rankers and those who have cracked the NEET PG September 2021 session, which are very good marks. So, I am very glad to share their picks with you. I also want to start with the MCQ session. All the best students. So, those students who have joined, we will have the session quickly. So, let's come up with the anatomy MCQ session targeting INI-CET examination. All the best to everyone. Paraurethral gland is homologous to which of the following structure? Paraurethral gland is homologous to which of the following structure? Whether testes, prostate, seminal vesicles, bulbourethral gland or epididymis. Okay, those who have joined can mark the correct answer. Paraurethral gland is homologous to which of the following structure? Testis, prostate, seminal vesicle, bulbourethral gland or epididymis. Your time starts now. You will get 30 seconds for marking the correct answer. Otherwise, I will come up with the explanation also. Don't worry. So, all those who have joined can mark the answer. Question number 1. We have got a total of 10 MCQs together today in this session. And after that, again from 6 p.m. we will start with the special class. So, those who want to have the continuation of the session, they can connect me with the special class which is on 6 p.m. There is 15 MCQ session. Mednair has given the answer. So, Aisha Frido. So, I am getting the answers, waiting for others to also answer. Okay. So, first thing which I want to tell you that paraurethral gland, when I am talking about paraurethral gland, this is a gland which is also called as Skinny's gland. Okay, this is the other name. This is also called as Skinny's gland and it is the gland which is lying within the wall of distal female urethra. So, where is the location? What is the location? It is located in the distal female urethra. Okay, so yes, Sushmita has given B, yes, and B is absolutely correct answer. Yes, paraurethral gland is homologous to prostate gland. Absolutely right, Sushmita. You are absolutely right. Actually, it is secreting mucus during sexual intercourse and it is homologous to prostate gland. Okay, so actually the other gland which is provided, bulbourethral gland. I will also show you the opening of this gland. Just wait, I will show you the diagram also. When we are talking about the bulbourethral glands in the female, it is homologous. Can anybody tell me bulbourethral gland is homologous to which structure? So, like paraurethral gland. So, all of you should note down this point. This is very important for MCQ. Paraurethral gland is homologous to prostate gland and bulbourethral gland is homologous to which structure? Can anybody tell me the answer? Bulbourethral gland is homologous to which structure in female? Bartholin's gland. Okay. So, prostate gland of male is homologous to paraurethral gland or Skinny's gland of female and Bartholin glands in the female is homologous to bulbourethral gland of male. And actually the other name of Bartholin gland is, it is also called as greater vestibular gland. All these are very important. These information is framed as an MCQ and has been asked in the previous year. Okay. So, let me show you this diagram where you can see the opening also of the Skinny's gland. Okay. So, what I told you, it is opening in the wall of urethra, distal urethra. So, all of you can see here, this is the Skinny's gland which is also called as paraurethral gland, and what you can see, the opening of Skinny's gland, this is the opening of Skinny's gland which is located in the distal urethra. And when I am talking about the Bartholin's gland, which is another gland of the female structure, which is homologous to bulbourethral gland, it is opening just, this is the opening and this is just opening on the right and the left side of the vaginal orifice. So it is opening at the right and the left side of vaginal orifice. So yes, we have done with this. So yes, let's move on to the next MCQ, that is MCQ number, let's move on to the next, that is MCQ number 2. Yeah. Now question number 2. In the following nutrient artery to the bone, which of the following is the wrong pair? Question number 2, mark the correct answer. In the following nutrient arteries to the bone, which of the following is the wrong pair? Humerus, profunda brachii, radius, anterior introosseous, fibula, peroneal, tibial, anterior tibial. According to you, which is the wrong pairing done? So all the best to Mednair, Aisha Firdaus and Sushmita. Mark the correct answer. Question number 2, your time starts now. Which is the wrong pair? Which is the wrong pair? Your time starts now. Question number 2. Okay, let me give the answer. So actually the wrong pairing is done in this. Okay, tibia. So this D is the correct answer. Why? Because this is wrongly paired. Okay, it is wrongly paired. When we are talking about tibia, the nutrient artery of tibia is, please note down, tibia, in case of tibia bone, the nutrient artery is posterior tibial artery. It's the posterior tibial artery. Nutrient artery is posterior tibial artery. Please note down, all of you. It's posterior tibial artery is the correct pairing. So this is the wrong pairing. All other options are absolutely right. Humerus is paired with profunda brachii artery, radius is paired by anterior introosseous artery, and fibula is paired by peroneal artery. So above 3 pairing is absolutely correct, except the 4th one, which is wrongly paired, that is tibia with the anterior tibial artery. Okay, let's move on to the next, that is question number 3. Yeah, no worries, no worries. Important is that we should have the revision of all the points. So please note down, these are the pairing. Humerus always is the profunda brachii artery. In radius में anterior introosseous artery is the blood supply or the nutrient artery, fibula में peroneal artery, and tibia में posterior tibial artery. Now let's move on to question number 3. All of the following are found in the lung except which of the following cells are normally not found in the lung? Question number 3. Which of the following cells are normally not found in the lung? Clara cells, Langerhans cells, brush cells, Kulczycki cells. Kulczycki cells. Okay. So yes, Sushmita has given the answer and she has given perfectly right answer with a good explanation that the correct answer is D, that is Langerhans. And yes, absolutely right, Sushmita. Langerhans is the cell which is found in skin. Absolutely right. Yes, it's the cell which is found in the skin. So this is the wrong one, and so D is the correct answer. All other cells which is mentioned here, actually Langerhans cells are antigen presenting cells. Langerhans cells are antigen presenting cells, and these are the cells which is found in the skin. In case of pathological conditions, okay, in case of pathological conditions, it may be found in the lungs. So pathologically it can found in the lungs also. All other cells, that is like the brush cells, the Clara cells, Kulczycki cells, all these cells are found in case of lungs. Okay, now let me just tell you about the cells in brief. So when I am talking about Kulczycki cells, it's a neuroendocrine cells. It's a neuroendocrine cell which is found in the lining epithelium of the lung. It is found in the lining epithelium of the lung. Yes, Mednair, I am giving the explanation. Please note down. Please note down, dear. Mednair, I am giving the explanation. Aditya, everyone, please note down. The options which is provided, I will tell you where it is located and what is its function. So the first one, Kulczycki cells are neuroendocrine cells located in the lining epithelium. It is located in lining epithelium cells of the lung. It belongs to APUD group. And it secretes, what is its function? Function is that it secretes serotonin. Clara cells. Now, if I talk about Clara cell, it is non-ciliated cells. It is a non-ciliated cells, and it's a columnar cells which is located in the part of terminal and respiratory bronchioles. It is located in the parts of terminal and respiratory bronchioles. Actually, when we are talking about Clara cells, its function is, what is its function? Clara cells is acting as a stem cell, and it secretes surfactant lipoprotein. It is secreting. What does it secrete? It secretes surfactant lipoprotein, like those of type 2 pneumocytes. And brush cells. What do you mean by the brush cells? So when we are talking about the brush cells, it is having small projections. Okay, so it is having microvilli. Brush cells will have microvilli, and they act as a receptor cells. They are acting as a receptor cells. Langerhans cells, we have already seen, it is an antigen presenting cell. So is it okay? Can we move on to the next MCQ, everyone? Med Nair, Aditya and everyone, Sushmita, Aditya Kumar, Sushmita, Fridosh, Aisha. So let's move on to the next MCQ. Okay, Med. Okay, Med. Let's move on to the next, that is question number 4. Panniculus adiposus is seen in. Panniculus adiposus is seen in scrotum, orbit, eyelid or penis. Okay, Sushmita. Mark the correct answer. Question number 4. Panniculus adiposus is seen in, your time starts now. Question number 4, mark the correct answer. A, B, C, D are the options, and your time begins now. It is located in which of the following structure? Panniculus adiposus. Okay. So first thing is that you have to know what do you mean by panniculus adiposus. The first thing is that we have to concentrate and we have to know what does this word panniculus adiposus means. Actually, panniculus adiposus means subcutaneous fat collection. What does this means? This means for subcutaneous fat collection, and it is seen in, the correct answer is, it is seen in orbit. Okay. Orbit is the correct answer. The accumulation of fat in the subcutaneous layer is given a term panniculus adiposus. So for importance and for MCQ series, it is important that you should know that panniculus adiposus, which is a subcutaneous collection of fat, is lying just below the dermis layer, and it is absent in which of the following structure. So please note down, that is important for everyone. So please write down. Everyone, panniculus adiposus. Panniculus adiposus means subcutaneous fat collection. What does this mean? This means subcutaneous fat collection. The location is underlying the dermis layer. So next important point is, it is absent in. So which are the structures where this is not present? Which are the locations where subcutaneous or the panniculus adiposus is not present? Please complete the list. It is not present in eyelid. It is not present in eyelid. Okay. So all of you please note down. It is not present in eyelid, areola, scrotum, penis, nipple, also in the external ear. So these are the list of the structures where we are not having panniculus adiposus. There is absence of panniculus adiposus. So everyone, is it okay? Let's move on to the next. Please give me a thumbs up if it is okay, and I can move on to the next MCQ. Okay. So yes. Question number 5th. Okay everyone, Sushmita, Med, Aditya, everyone, those who are present. Let's move on to the next MCQ, that is MCQ number 5. Nerve of Würzburg contains secretory, sensory, parasympathetic fibers. So can anybody tell me what is nerve of Würzburg? Can anyone tell me what is nerve of Würzburg? Actually, the other name for nerve of Würzburg is intermediate nerve, nervus intermedius. So first thing which I want you to tell is that you should know the other name of the nerve. So the other name of the nerve is, it is also called as, please note down, nerve of Würzburg is also called as, so what is its other name? So please note down, please don't get confused. It is also called as nervus intermedius. It is also called as glossopalatine nerve. These are the names of the nerve. Actually, this is the nerve. This is the sensory component of the facial nerve. And actually, when we are talking about the whole nerve of Würzburg, it's the part of the facial nerve. It is exactly located between the motor component and the vestibulocochlear nerve, and it is having all the above fibers. It is containing all the above fibers. It is containing sensory and parasympathetic fibers. It contains both sensory and parasympathetic fibers. Okay. So Shushmita Medna, yes, sensory component. Yes, it's a sensory component of the facial nerve, but if we have to choose the answer, we will go with, yes, we know that it is sensory component, we will go with all of the above, because it is also containing parasympathetic. So parasympathetic fibers means secretory fibers, okay. Got it, everyone? So please note down, those who want to, please note down that this is a nerve which is called as sensory component, but it is having both the parasympathetic secretory component. It is containing both parasympathetic and the secretory component of facial nerve. So we will go with D as the correct answer. To confuse you, the examiner can include the word like nerve of Würzburg, nervus intermedius and glossopalatine nerve. All is same. Now, question number 6. So, what is this? This will be question number 6. Okay. So, all of you please note down, this will be question number 6. Center of stapedial reflex. The next question is center of stapedial reflex. Center of stapedial reflex is superior olivary complex, inferior colliculus, lateral lemniscus, medial geniculate body. Okay. So question number 6, mark the correct answer. Center of stapedial reflex is superior olivary complex, medial geniculate body, inferior colliculus, lateral lemniscus. So your time begins now. Mark the correct answer. Whether it is right or wrong, please do attempt. Question number 6. Yeah, I got an answer from Aisha Firdos. And my dear aspirant, Aisha is absolutely right. Is the superior olivary complex. Yes, Aisha, you are absolutely right. So when we are, actually the other name of stapedial reflex is stapedial reflex. What do you mean by stapedial reflex? It is also called as acoustic reflex. It is also called as acoustic reflex. So here the center has been asked. It is not the pathway, so we will not go with inferior colliculus. Okay, Sushmita, यहाँ पे center पूछा गया, तो we will go with superior olivary complex. Actually, what is the location of superior olivary complex? Please write down. Superior olivary complex is located. What is the location of superior olivary complex? The location of superior olivary complex is in the pons. It is located in the pons. And its role is hearing, and it is consist of superior olivary nucleus, medial and lateral superior olivary nucleus. It is consist of medial and lateral superior olivary nucleus. It is composed of medial and lateral superior olivary nucleus. Okay. Now, my dear aspirants, I would like to give you a brief account of the acoustic reflex. When we are talking about acoustic reflex, which is also called as stapedius reflex as mentioned in the MCQ. Now, when a person presents with an intense sound stimulus, what happens? The stapedius, two muscles contract. Okay. One is the stapedius muscle, other is the tensor tympani muscle. Stapedius muscle having the innervation from 7th cranial nerve, tensor tympani from the 5th cranial nerve, mandibular division. The stapedius muscle stiffens the ocular chain by pulling the stapes of the ear ossicles, the smallest ear ossicles of the middle ear, away from the oval window of the cochlea. So, this is how it protects the ear from loud noise. The tensor tympani muscle stiffens the ocular chain by loading the tympanic membrane, and it pulls the malleus. It is pulling the malleus, that is the hammer part, towards the middle ear. So, this is how these two muscle is contracting, and it is saving the ear from the high frequency sounds. This is how, so they are protecting the ear from high frequency sound. Now, it is also important that that you should know about this component of acoustic reflex. So, write down heading acoustic reflex. Acoustic reflex is having an afferent component and it is having an efferent component. Two components are there. One is afferent and the other is efferent. Afferent is via 8th cranial nerve, via cochlear nucleus, and reaches the center, that is superior olivary nucleus. Superior olivary nucleus, which is the nucleus of hearing, from where proceed to 7th cranial nerve, which is acting as an efferent nucleus. This is the efferent nerve nucleus, 7th cranial nerve, 7th. Through 7th nucleus, cranial nerve nucleus, and it will lead to stapedius muscle contract. Stapedius muscle contract, and this is how it happens. This is called as acoustic reflex. This is how this is the whole pathway of acoustic reflex. So, done with this. I would also like to show you this diagram. See here, this is how it happens. Okay, so let me just stapedius muscle contraction has to happen. Auditory nerve via cochlear nucleus, the center of the reflex is superior olivary nucleus, via motor nucleus of the 7th nerve, and via facial nerve it will lead to the contraction of stapedius muscle. This is how, this is the pathway of acoustic reflex or the stapedius reflex. Then let us move on to the next, that is question number 7th. Okay everyone, let us move on to question number 7th. Okay, this is also, this is the question number 7th, please mark it, question number 7th. Okay, question number 7, it is not the 6th one, it is the 7th one. Mark the answer. Following statement regarding the branches of external carotid match is correct. Actually, this was asked in the previous year. It's the new pattern of MCQ which is asked in INI-CET examination. It was asked in AIMS entrance examination 2 years back. So, you have to match the following. You have to mark this correct answer by matching the following. Take your time and just see which is the first branch, which is the medial branch, which is the terminal branch, and which is the arterial supply for the major part of tonsil. Among the option provided, maxillary artery, ascending pharyngeal artery, superior thyroid artery, facial artery, lingual artery, posterior auricular artery. So you have to match the following and then tell me the correct answer, whether it is A, B, C or D, which is the correct matching. So take your time, I will give you 30 seconds for marking the correct answer. Your time begins now. Question number 7th. So Aisha has also given the answer, Sushmita has also given the answer. I will match it for you and then I will see which combination is the correct answer. Okay, let me keep like this. Yeah. So yes, okay, answers are coming up. So I am getting Nadeem Ahmad Ansari has given the answer, Aisha has given the answer. Okay dear, okay. Let me now do the match the following. So yes, first branch of external carotid artery is, so the first branch of external carotid artery is C. So superior thyroid artery. So I am doing the match the following. Superior thyroid artery is the first branch for the external carotid artery. 1C is the correct option. So yes, medial branch 2 का क्या होगा? Medial branch is ascending pharyngeal artery, 2B. Okay, so I got 1C, I got 2B. Okay, now terminal branch is maxillary artery, so 3A. Yeah, major arterial supply to tonsil is by a facial artery, so 4E. So 1C, 2B, 3A and 4E. So the correct answer is B. So the correct match the following is B. Okay, 1B and 1C. Okay dear Sushmita, it's okay. Okay dear, nothing to worry. Yeah, it's okay. So please note down, the first branch is superior thyroid artery. Superior thyroid artery is the first branch. Superior thyroid artery is the first branch. So 1B is the, so we have got 7th answer, B as the correct answer. Let me show you this, okay. So see here, this is the diagram where you can appreciate the branches of external carotid artery. The branches of external carotid artery. This is a diagram showing branches of external carotid artery. This is a diagram where you can see the branches of external carotid artery. Got it? Now, so external carotid artery में superficial, temporal and maxillary artery, these are the two terminal branches. Please note down, these are the two terminal branches. Posterior auricular and the occipital artery, these are the two posterior branches of external carotid artery. Now, facial artery, lingual artery and superior thyroid artery, these three arteries are anterior branches. These three arteries are anterior branches. These three arteries are anterior branch of external carotid artery. When we are talking about ascending pharyngeal artery, this is the medial branch of, ascending pharyngeal artery is the medial branch of, external carotid artery. Got it? It's the medial branch of external carotid artery. So done with this. Ashish Jha, yes, IAS 2 PG for third branch. Okay, Ashish, yeah, what you are asking? Third branch IAS. Okay, let me just show you. I think this explanation is clear to you. All the branches I have summarized. Now, I also want to show you this diagram where you can see the major branch, actually the tonsillar branch of facial artery is an important arterial supply for tonsil. Please mark it. Tonsillar branch of facial artery is an important arterial supply for tonsil. Okay everyone, let's move on to question number 8. Let's move on to question number 8. Okay. So, any doubt? Is it okay everyone? Have everyone understood? Let's move on to the next MCQ, that is question number 8th. So, this is which one? This is the 8th number question. 8th number question. Superior most structure in the hilum of, your time starts now, 30 seconds for you everyone. Yes. Superior most structure in the hilum of right lung. Right lung. I am asking about right lung. Superior most structure in the hilum of right lung. Right lung. Your time starts now. Mark the correct answer. Superior most structure in the hilum of right lung. Okay, Sushmita, Aisha, Asi, everyone has absolutely given the right answer. Very good. Everyone has given the right answer. Actually, what happens in the right side of the lung hilum, there is the principal bronchus dividing into eparterial and hyparterial bronchus. So, superior most structure will be eparterial bronchus. Absolutely right. Now, let me show you this diagram. Okay. So, here you can see this is the hilum of the right lung. This is showing the hilum of the right lung. Let me slightly enlarge this diagram. Here, if you will see clearly, if I just show you clearly, let me slightly more highlight this diagram. Okay, just see the hilum structures. Okay. So, when you will concentrate on the hilum structure, what you can see here, there is the superior lobar bronchus and there is also middle inferior lobar bronchus. So, bronchus is dividing here. You can see here. In this case, the bronchus is dividing. So, other structures which you can see is the pulmonary artery, the veins, superior, inferior pulmonary veins and all are there. But here the bronchus is dividing. This is the inferior pulmonary vein. Okay, let's move on to the left hand side. When I am talking about the left hand side, mainly there is one bronchus here. And the other structures are pulmonary artery and inferior pulmonary vein. So, in both the structures, pulmonary vein is inferior pulmonary vein. Now, this is a schematic diagram to make you understand. When we are talking about the structures in the hilum of the lung, what do you mean by hilum of the lung? Hilum of the lung means the area where the root structures are going in and out. Root structures means pulmonary artery, veins and bronchus. So, what you can appreciate when we are talking about the right hand side, there is eparterial bronchus and there is hyparterial bronchus. But in case of left hand side, there is only one bronchus, that is principal bronchus. Okay, in the left hand side, there is just one bronchus, that is principal bronchus, nothing else. This is wrong. So, we have got just one bronchus. Let me use green color. So, just one bronchus is there. This is called as the principal bronchus in case of left lung. But in case of right lung, eparterial and hyparterial bronchus. Now, so superior most structure will be eparterial bronchus, then will be the pulmonary vein artery, then will be the hyparterial bronchus and lowermost structures for both will be the inferior pulmonary vein. So, is it clear? Inferior pulmonary vein is the lowermost structure for both right and the left side of the lung hilum. If you can see, the pulmonary vein is inferior most structure, superior most structure in the right hand side is eparterial bronchus. And superior most structure in left hand side is pulmonary artery, then is the bronchus and inferior most structure is the pulmonary vein. So, is the comparison okay? This systemic diagram is giving you a good comparison between the hilum structure of both right and the left hand side. Let's move on to the next. Is it okay? Can I move to next MCQ everyone? Please let me know. Can I move to next MCQ? Yeah, just a minute. Okay, everyone? Yes. So, yes, let's move on to question number 9th. Okay, 9th number. Question number 9th. Yes, okay. Question number 9. This is the 9th number MCQ. strongest layer of esophagus is? Which of the following? Mucosa, submucosa, muscularis externa or serosa? Among the option provided, which of the following is the strongest layer of esophagus? Which of the following is the strongest layer of esophagus? Mucosa, submucosa, muscularis externa and serosa. 4 options are there. Mark the correct answer. All the best to everyone. Time starts now. Your time starts now. Sushmita is telling it's B. What about others? What about others? Ashish Jha is also telling it's B. Okay. Okay. Strongest layer of the esophagus. Actually, the correct answer is submucosa, and all of you are absolutely right. So, please note down a submucosa layer of the esophagus. Submucosa layer of esophagus is the strongest layer of esophagus. Why? Because submucosa layer is consist of fibroelastic connective tissue. It is consist of fibroelastic connective tissue. It is consist of fibroelastic connective tissues. Got it? It is consist of fibroelastic connective tissues. It is consist of blood vessels and the nerves are traversing through it, and it is the strongest component of esophagus layer. Okay, this layer is so strong that submucosa layer is used for anatomic sutures. For sutures also we use this layer. Now I would like to show you this diagram where you can see this is the diagram showing histology of the esophagus. This is the high power view. Let me slightly enlarge. Here you can see the epithelium is multiple layered. Can anybody tell me what is the lining epithelium in case of esophagus? Lining epithelium. So as it's a GIT tract structure, so 4 layers honge: mucosa, submucosa, muscularis layer and the serosa or adventitia. The innermost layer, as we proceed from the luminal aspect, is the epithelium. Mucosa is consist of epithelium, and the lining epithelium is stratified squamous non-keratinized epithelium. Non-keratinized epithelium. Okay, this is about the epithelium layer. Then we have got LP for lamina propria. Then we have got muscularis mucosae. This is what? This is MM for muscularis mucosae. The next, so this is the first layer. The second layer is the submucosa, which will contain the submucosa layer, which contains the esophageal proper gland. These are all glands, and these are esophageal proper gland. It contains esophageal proper gland. It contains esophageal proper gland. Then we have got the muscularis layer. What is muscularis? External layer. It is consist of circular and longitudinal, 2 layers, inner circular, outer longitudinal layer. So this is the third layer, and the outermost is the serosa layer. 4 layers are there. How many? 4 layers are there. So this is whole about the histological aspect of esophagus, and most of you has absolutely marked the correct answer. The correct answer is submucosa layer is the strongest layer of esophagus. Moving on to the next, that is question number 10th. Question number 10th. Which nerve arises by 2 roots and it surrounds the middle meningeal artery? Which nerve arises by 2 roots and it surrounds the middle meningeal artery? Whether it is auriculotemporal nerve, buccal nerve, the mental nerve or the zygomatico-temporal nerve. 4 options are there. 30 seconds for you. Mark the correct answer. Which nerve arises by 2 roots and it surrounds the middle meningeal artery? 4 options are there. Mark the correct answer. Okay. So, yes. Okay, so question number 10th. Okay, so many answers are coming up. A. Okay, so it's a direct question and absolutely right. Yes, auriculotemporal nerve is absolutely correct answer. I would like to share an image which will give you the relation auriculotemporal nerve is encircling, looping around the middle meningeal artery. It's a very important relation which we, when go for cadaveric dissection also, this is the identifying point where we see that the loop formed by auriculotemporal nerve, and through that loop middle meningeal artery is traversing. Let me show the diagram for it. So this is the diagram. Now here what you can see, if I want to show you, this is what I am using is the yellow color. This yellow color loop is of auriculotemporal nerve. What is it? This is the auriculotemporal nerve. Auriculotemporal nerve is shown. And what you can see, the auriculotemporal nerve. So auriculotemporal nerve is looping around an artery, and which artery is this? The artery which you are seeing here. This is the artery, and this is middle meningeal artery. So very nicely you can see middle meningeal artery around the loop is formed by auriculotemporal nerve. Okay. So this is clearly seen in this relation. Very nicely you can appreciate this relation here. Got it? Let's move on to the next, that is question number 11. Okay everyone, let's move on to question number 11th. This is 11. All of you please write down the answer. Which of the following is derivative of Richard's cartilage, stapes, malleus, incus and sphenomandibular joint? So all of you, I will please mark the correct answer, and thereafter 6 p.m. is the session. Use the code NAT10 and join me for the 6 p.m. session also on the special class. I just want to give you information because I want that this continuity is not broken at, and you can reach to the platform of Unacademy special classes where we can have a session of 15 more MCQs. Question number 11, mark the correct answer. Which of the following is a derivative of Richard's cartilage? Richard's cartilage derivatives: malleus, incus, stapes, sphenomandibular joint. Absolutely right, most of you are correct, and the correct answer is stapes. Yes, stapes is absolutely correct. All other options like malleus, incus, sphenomandibular, these malleus, incus, all these are for the first arch, and stapes is derived from the second arch, and Richard's cartilage is the arch, is also derived from second arch. So we have got A as the correct answer. A as the correct answer. So my dear aspirant, let me show you this diagram. This is the, let me slightly highlight it and show you the derivatives of first, second and third arch is, when we are talking about the derivatives of first arch, it forms incus, malleus, sphenomandibular ligament and lingula of mandible. All of you do revise. Let me slightly highlight this. Okay. So these are the structures which is derived from first arch, and when we are talking about second arch, the derivatives are stapes, styloid process, stylohyoid ligament, lesser corona and the part of hyoid bone. Okay. It's the stapes, it's the styloid process, it's the stylohyoid ligament, lesser corona and body of the hyoid bone. When we are talking about the third arch, it is from the greater corona, part of the hyoid bone. Fourth arch, laryngeal cartilage. So all of you please do revise. This is also a very important MCQ questions for the NEET PG INI-CET examination, and these are the structures which is derived from the following arch: first, second, third arch, first, second, third arch, and also the fourth arch, that is laryngeal cartilages. Okay. So my dear aspirants, we have done with this. Tomorrow also exactly at 5 p.m. the YouTube session of MCQ sessions will be there. But before ending the session, what I want you to tell. So now today is Monday. So Monday, Tuesday, Wednesday and Thursday, exactly at 6 p.m. Exactly at 6 p.m. daily, the sessions are there on the Unacademy platform. So I am coming up with the Unacademy platform, that is the Anatomy MCQ Marathon. So join me for the Anatomy MCQ Marathon right now. So 6 p.m. is the timing. All of you do join me. Use the code NAT10 to unlock and be present. Unlock. If you are using the platform for the first time, use the code NAT10 to unlock the session. Be present for the live sessions. Be present for the live sessions on the Unacademy platform. And now I am continuing the sessions on the special class. Okay, all of you can join me, and thank you. Do subscribe, and if you want to take the subscription also, you can use my code NAT10. So for that also you can use my code NAT10. Okay, Sushmita. So yes, now 6 p.m. session, 15 more MCQs on the platform of Unacademy. So in the, what is the positive point about the platform of Unacademy is that you can download the PDF notes also. So do join there, download the PDF note after completion of the session. Thank you. Do subscribe. Let's crack NEET PG platform and use the code ANAT10 if you want to take the subscription of Unacademy. All the best. Keep studying. Thank you so much, Sushmita and everyone, those who were present. Thank you so much. We'll meet up with the next session. Thank you. Thank you, all of you. Thank you, Ashish. Thank you, everyone. Thank you. Let me just end the session now. All the best, everyone. All the best. Okay.